Hi, everybody. Hello, hello. We are going to kick off today's WTF show, and we are awaiting a special friend and colleague. Hello, welcome. It's been a little while since we've been able to do one of these WTF shows. I'm so excited about tonight's conversation. I'm waiting for my friend and colleague to join. Um, let's see. Nope, not yet. Let's see. Oh, we have lots of friends joining the room tonight. So happy to see you all. Hope you're hanging in okay. I know it's really quite challenging. And oh, okay. So he's here. Oh my goodness. Hello. Hi, everybody. Good evening. Okay, that did not work. Um, oh, yes. Hi.
Good to see you.
Okay, so everybody, welcome to the WTF show, where House Democrats are going to be going live every Wednesday, Thursday, and Friday of the first 100 days of the Trump administration. I'm so excited about tonight because we are joined by my friend and brilliant colleague, Dr. Raul Ruiz, all the way from warm, beautiful, sunny California.
Southern California, in
Yes,
fact, near
yes. How
Palm
are you?
Springs. I'm doing well. I'm doing well.
Okay,
Thank you.
good, good. So we have a lot of folks on tonight because we are here to talk about healthcare. And I know there's been a lot of news that's come at us so quickly, right? Just fast and furious. They say they're going to flood the zone. But Congressman Ruiz and I really bonded, didn't we, on our healthcare background?
We did. We did. I'm an emergency medicine doctor by training and specialty, and I also have some public health specialization, a master's in public health, and practice public health as well. And I have some training in humanitarian disaster aid, and have been in Haiti right after the earthquake and some other places. So health and social justice and things to do with making sure that people have access to healthcare has been a fight for me for many years.
And we find ourselves in the midst of a battle right now. And this is something that we need everybody's voices to be part of because of these attacks that are coming to Medicaid. You know, this community came together to save our healthcare in 2017. And unfortunately, I think we're going to have to do it again because of legislation that's coming to the floor next week. So, Congressman Ruiz, why don't you catch everybody up on the current state of affairs and the fight to save Medicaid?
Well, we've known that under Project 2025 and the Trump campaign that they want to pursue a massive tax bill that will give more billions to billionaires. And we had said that they're going to do it on the backs of hardworking Americans, and going after programs that are essential for many middle class families, those aspiring to be in the middle class, like food support and healthcare. And so what we're seeing now is the Republicans instructing the Energy and Commerce Committee, of which I sit in, as well as the Health Subcommittee, to cut about a little over $800 billion. And so when you look at the programs that we have oversight for, Medicaid has and will be a big target for them. And so Medicaid is a partner insurance from the federal and the state program. In California, it's known as Medi-Cal, that covers a lot of essential services for people who are underinsured or are struggling or have disabilities, or the elderly who need home assistance or
And a
nursing
lot
home
of
care.
kids.
Yeah, and
A lot of kids.
kids. So in fact, I would say about 27% of Californians use the Medicaid program. And I represent one of the most under-resourced district in the state of California. So the population in my district is 42%, that nearly one out of two residents use the Medicaid program in my district. And so what does that mean when they want to cut it? They will cut it in many different ways. They will, one, make it difficult for people to register for Medicaid by putting work requirements. so that the single mom who's working hard at home, taking care of her two kids, who is working one or two part-time jobs or a full-time job, will now have the extra burden of having to fill out forms, going online, if they have broadband, if they're internet savvy, to fill out these reports.
Yep.
That system's designed to weed them out. The second reason why that's not fair is because my district also has a high unemployment rate, higher than the state average, higher than the Fed, the national average. So if you don't got any jobs available in your community, or if we have a economic crisis or another pandemic, what are you going to do? Lose your Medicaid too, for no fault of your own? So one, a lot of Republican governors are pushing back on the working requirements. The other way that they're going to cut it is by turning it into a block grant, meaning that you get a certain amount of money and then the rest you're on your own.
Yep.
Well, that's not good, because we have needs that go up and down due to disasters, due to pandemics, and you won't be able to account for that. They'll decrease the reimbursement rate from the feds to the state, or they'll just simply eliminate certain services that can be provided. So if all those things happen, and states will have to pick up the rest of the costs that have been traditionally shared with the federal government, then the states are going to cut. The first thing they're going to do is they're going to cut reimbursements to providers. We already have a physician shortage crisis, especially in rural America. We already have hospitals that are shutting their doors all over the United States because they can barely provide the services. If this happens, you're going to have less doctors and less hospitals taking Medicaid patients. Then you're going to have people that go to the hospital for emergencies, and they're not going to get reimbursed for that. So it's going to make the problem worse.
And what we
that's
see is when they try to cut these programs, people don't get the health care that they need, and then people die. Or kids don't get the health care that they need, and they get sick. They don't hit their milestones. They're not hitting their developmental goals. It's just devastating. And you mentioned elderly in the nursing homes, but imagine this. If so many of our seniors are kicked out of their nursing homes, where are they going to go?
Or they won't be able to get care in their homes. And look, one of the saddest cases I took care of were, and I did my emergency medicine training at Pittsburgh, and part of that training I did rotations at the Pittsburgh Children's Hospital. Was a young boy who was playing football and wrestling and tag with his stepfather, who came home from work, and they were playing there and having a good time. He suddenly went into an asthma attack, and because it was so severe, he came into the hospital in cardiac arrest.
Wow.
And the team of doctors that were working on him, and they don't call it for a child until they're absolutely certain. I mean, they'll go hours before they say, we've done enough and that's it. They called it and he died.
Wow.
And I was in with the fellow to tell the parents that their son, their 9-year-old son, just died from an asthma attack. We would see more of these cases.
That's right.
Because without the Medicaid, these parents who are struggling to make ends meet will not be able to have the appropriate and the routine care and the medications that are required to keep young children with asthma healthy.
That's right.
And that means that they would have higher asthma rates, higher complications, and they would go to the emergency department.
But guess what?
And
this isn't inevitable, is it?
No.
There's a way for all of us on this call to take action. There's a way for us to stop this devastation from coming to your community or to my community or any community around the country. And so we have this rallying cry where we need your help. We need people to reach out to Republican members in the House, because we just need 3 Republicans to stand with us to save Medicaid. And in this moment, there's a really important vote happening next week. And so if all of us raise our voices and we reach out to one Republican House member at a time and tell them to please protect our health care, we'll be able to prevent this devastation. And I certainly received a lot of calls. I don't know about you, Raul. Have you been receiving a lot of calls?
We've been receiving a lot of calls about a lot of things that are happening right now in our government, Lauren. And one of the things that we need to really start practicing is how to use our voice, how to create public sentiment, how to stand up so we can organize and to do multiple things at the same time. This flood the zone strategy is a shock and awe to keep people confused or in a state of chaos, and they would not act. And so we need to focus, I believe, and we can defend our democracy and our Constitution and make sure people understand, especially those that voted under the false premise that Trump ran to lower the cost of living. And instead he's out there fighting a cultural war, dismantling our government to give the presidency unprecedented powers and disregarding our Constitution. The sense of is this going to impact their everyday lives? And there's nothing greater of an impact in a person's life than their health. And when they don't have access, when they're sick, when they're in pain, or when their loved one is in a medical emergency because they couldn't get it taken care of before, and it's led its course, and now they have to go to the emergency department, they're going to feel it, and they're going to start to understand why these policies are actually harmful and will make America sicker again. And so this is when we need to call and stand up and push back on this god-awful, morally wrong budget that is going to strip away access to health care for over 10 million people in California alone, and many more across our nation. And we need to do it quickly, and we need to do it now.
Well, good thing we're joined tonight by so many advocates who are willing and ready to take action to save our healthcare. I know that folks are standing with us. They are ready to start making calls tomorrow to reject the budget resolution, to save Medicaid, to protect our healthcare, and we just need 3. Congressman Ruiz, thank you for being such a bold voice in the Congress for healthcare and for our nation's doctors and for all of our families. It's been so fun to be able to do this tonight with you.
Thank you so much, Lauren, for the invitation.
Take care, everybody.
Bye-bye.